Case 1. A patient with severe hypertension presents after eating aged meats and cheeses. She has a history of treatment-resistant depression. The most likely cause is a hypertensive crisis due to a monoamine oxidase inhibitor interacting with tyramine-rich foods. Monoamine oxidase is an enzyme that breaks down neurotransmitters such as dopamine, norepinephrine, and serotonin. Inhibition of this enzyme leads to excess monoamines. Tyramine ingestion further increases catecholamines, causing severe hypertension, headache, and autonomic symptoms. Case 2. A patient develops tremulousness, agitation, and elevated heart rate and blood pressure within 48 hours of hospital admission. This presentation is consistent with alcohol withdrawal. Alcohol enhances GABA activity, which is the main inhibitory neurotransmitter in the brain. Abrupt cessation decreases inhibitory tone, leading to central nervous system hyperactivity. Symptoms begin within 8 to 12 hours and include insomnia, anxiety, tremors, and autonomic instability. Seizures may occur within 12 to 48 hours. Special topic: delirium tremens, characterized by confusion, agitation, and fever, typically occurs within 48 to 96 hours. Benzodiazepines such as lorazepam, diazepam, and chlordiazepoxide are the first-line treatment. They enhance GABA activity and help prevent seizures and progression to severe withdrawal. Long-acting benzodiazepines are preferred because they provide a smoother and self-tapering effect. Autism spectrum disorder, ASD, autism spectrum disorder. Autism spectrum disorder is characterized by deficits in social communication and interaction, with onset in early childhood. Patients have impaired social engagement, impaired nonverbal communication, such as poor eye contact and limited gesturing, and difficulty developing or understanding relationships, including reduced interest in peers. They also present restricted and repetitive patterns of behavior, such as repetitive movements or speech, insistence on sameness or routines, intense fixated interests, and adverse responses to sensory input. Autism spectrum disorder may occur with or without language impairment and intellectual disability. Diagnosis and management focus on early identification and early intervention. Treatment is comprehensive and multimodal, including speech therapy, behavioral therapy, educational support, and pharmacologic treatment for psychiatric comorbidities. Case 3. A 2-year-old boy with lack of social engagement, speech delay, and repetitive play is consistent with autism spectrum disorder. Autism is more common in boys. Symptoms are often apparent by the 2nd year of life, and diagnosis is typically made before age 5. Case 4. A patient with schizophrenia is started on clozapine. The most important parameter to monitor regularly is the absolute neutrophil count. Clozapine is indicated for treatment-resistant schizophrenia and schizophrenia associated with suicidality. Adverse effects include agranulocytosis, seizures, myocarditis, and metabolic syndrome. Clozapine has superior efficacy in treatment-resistant schizophrenia. It binds loosely to dopamine D2 receptors, which results in fewer extrapyramidal symptoms compared to first-generation antipsychotics. Due to the risk of life-threatening agranulocytosis, regular monitoring of ANC is mandatory. Case 5. In a patient with chronic alcohol use, the earliest symptom of withdrawal is tremulousness. Withdrawal symptoms can begin as early as 6 hours after the last drink, peak within 2 to 3 days, and resolve within 4 to 5 days if not severe. Early symptoms include tremor, anxiety, insomnia, nausea, vomiting, and mild autonomic hyperactivity such as tachycardia and increased respiratory rate. Tremor, also called the shakes, is typically the earliest and most common symptom. This is the most severe form of alcohol withdrawal. It typically occurs 48 to 96 hours after the last drink.